Tantor Audio, a division of Recorded Books, presents Insane Consequences: How the Mental Health Industry Fails the Mentally Ill by D.J. Jaffe. Foreword by E. Fuller Torrey, M.D. Narrated by David Marantz. Publisher's Note: in this audio edition, you may hear references to visual elements present in the print and e-book formats of the book. What is remarkable about recent history is how the traditional advocates of the downtrodden played a major, although unwitting, role in putting the mentally ill into conditions that would have shocked previous generations of Americans. Clayton E. Kramer, author of My Brother Ron, A Personal and Social History of the Deinstitutionalization of the Mentally Ill. Foreword by E. Fuller Torrey, M.D. Episodes of violent behavior, including homicides committed by individuals with serious mental illness who are not being treated, are a growing problem and have become a national disgrace. It has been widely claimed that the public mental illness treatment system is failing because of a lack of funding. But as is true in the American medical care system in general, the United States spends more on public mental illness services than most other countries, yet this funding results in significantly poorer services. The United States excels in putting people with serious mental illness in jails and prisons, or leaving them on the streets to fend for themselves. The problem is not a lack of funding, but rather how the funds are spent. We say that many of our sickest patients have a thinking disorder, yet the thinking that created the current mental illness treatment funding system is much more disordered than the thinking of our patients. Imagine having a $3.7 billion federal agency that is supposed to be coordinating federal policies for individuals with serious mental illness, but among its 575 employees, it does not have a single psychiatrist. This was the situation with the Federal Substance Abuse and Mental Health Services Administration, SAMHSA, or SAMHSA. And at the state level, things are not much better. Currently, only 3 states employ psychiatrists to oversee the state mental illness treatment system. A leadership void created the current mental illness mess. Insane Consequences is one of the most important books written on how to reform the system. D.J. Jaffe is the consummate public advocate. I know of nobody in the mental illness/mental health field who works as hard as he does or is as effective. When the Government Accountability Office, GAO, issues a relevant report, DJ reads all 128 pages plus the appendix, while the rest of us read only the executive summary. When the U.S. Senate introduces relevant legislation, DJ reads the entire bill, most of which is written in federal legalese. The rest of us just wait for someone else to summarize it. He is an expert in exploring government websites to fish out those small but damaging facts that the government agency retrospectively wishes it had not released. Many of us who advocate for improved mental illness services for individuals with serious mental illness have used DJ's findings and ideas many times. He is invariably generous and selfless in sharing what he has found, never asking to be publicly credited. Because DJ has studied the mental illness/mental health field so thoroughly, his ideas for reforming it deserve careful attention. D.J. Jaffe represents the very best principles of democracy. One man really can make a difference. It has been a great pleasure to have worked with him for over 20 years, and it is an honor to contribute a foreword to this fine book. E. Fuller Torrey, M.D., Bethesda, Maryland, January 2017. Author's Notes. Definitions. Where possible, this book differentiates between serious mental illness, SMI, and any mental illness. Briefly, Mental illness encompasses the over 300 diagnoses listed in the Diagnostic and Statistical Manual, DSM. Serious mental illnesses are the subset that substantially interfere with or limit the ability for someone to engage in major life activities. See Chapters 4 and 5. The book also differentiates between mental health advocates who don't advocate for the most seriously ill and mental illness advocates who do. In the mental health industry, peers and consumers refer to people who have a mental illness, used mental health services, or received a diagnosis. Anti-psychiatry refers to groups and individuals who generally deny that mental illness exists or that treatment is useful. They believe both treatment and psychiatry are damage or torture. Studies and interviews. Because single studies can be found to support any position, we examined multiple studies, often relying on collections created by the Treatment Advocacy Center, TAC or TAC, or Mental Illness Policy Org, MIPO. Where possible, we quoted studies appertaining to serious mental illness, not any mental illness. We tried to provide URLs for the studies when they were available, or to the abstract when they were not. However, authors often sanitize abstracts to downplay unpleasant or politically incorrect findings, so we have relied on the actual study rather than the abstract. Most studies are peer-reviewed, but we did include some non-peer-reviewed information from reputable sources like Dr. Thomas Insel, former director of the National Institute of Mental Health, NIMH. During years of advocacy, the author has spoken with and corresponded with thousands of individuals with mental illness and their families, and quoted some in this book. Real names were used when permission was granted. Names and some identifying information were changed in the few cases where individuals preferred to remain anonymous or could not be located. Proceeds. 100% of the author's net proceeds will be donated to organizations working to improve care for people with serious mental illnesses, including the Treatment Advocacy Center in Arlington, Virginia, and Mental Illness Policy Org in New York City. Updates. To keep up to date on mental illness policy, visit mentalillnesspolicy.org at mentalillnesspolicy.org, follow us on Twitter at mentalillpolicy, and like our Facebook page at facebook.com/mental-illness-policy-org-323-404-203-517. Also, visit the Treatment Advocacy Center at treatmentadvocacycenter.org, follow it on Twitter at treatmentadvctr, or like it on Facebook at facebook.com/treatmentadvocacyctr. To support efforts to improve care, make a tax-deductible donation to either organization. Disclaimer. This book does not contain medical advice or legal advice. Do not rely on it. Contact a doctor or lawyer if you need medical or legal advice. Preface. How I Got Involved. On September 2, 1985, my wife Rose and I picked up her 18-year-old sister Lynn at LaGuardia Airport. Lynn had been one of the best-liked, highest-performing students in her Wisconsin high school. She was attending community college and living at home with her lovable babushka-wearing Hungarian immigrant mom, a hard-working, church-going widow who cleaned houses to support herself and Lynn. But recently, their relationship soured. They started having bitter fights. One day, in an unprovoked psychotic rage, Lynn slapped the mom she loved. She was hospitalized for being mental, then came home, and after several weeks when her medications wore off, she repeated the behavior. My wife and I thought the problem was due to an American teen living with an old-world mom, and that moving Lynn to New York City to live with us aging hippies would solve all her problems. We were that stupid. At first, Lynn was the perfect New Yorker, taking long walks in Central Park, people-watching in our Chelsea neighborhood, and shopping in the East Village. But slowly, as the weeks went by, her concentration became scattered, and her speech became rushed, breathless, and pressured. Delusional thoughts would come cascading out of her mouth in an uncontrollable barrage of disconnected ideas that made no sense, even to her. She started becoming paranoid, convinced that conversations taking place across the street involved plots to kill her. One afternoon, after she spent hours screaming at the voices in her head, we took her to the emergency room. She was admitted, diagnosed, medicated, and provided rehabilitative therapy. But to protect her privacy, her doctor wouldn't tell us her diagnosis, what medications he'd given Lynn, or what would happen when her hospitalization ended. Lynn returned home to us and stopped taking the antipsychotic medications we didn't even know she'd been prescribed. She deteriorated again, started screaming at voices only she could hear, and engaged in pitched arguments with herself about Jesus, God, and the devil. We tried to get her to go back to the hospital, but she refused. She didn't think the problem was with her. She knew it was with us. She knew we were plotting to kill her. Her illness told her so. "I know you're trying to poison me. I'm going to kill you first," she said more than once. We called the police, hoping they could get her to the hospital. But when they arrived, Lynn went mute, so they didn't see evidence of her being a danger to self or others. "We can only help after she becomes violent, not before," the displeased officer informed us. Eventually, she slipped into catatonia, was re-hospitalized, and the pattern repeated. Hospitalize, stabilize on medications, go off medication, re-hospitalize. After Lynn underwent several ins and outs, a nurse remarked, "Well, people with schizophrenia often feel that." "Schizophrenia? Is that what she has?" my wife asked. "Didn't your doctor discuss that with you?" the nurse innocently inquired. "Nope, never did." I started researching schizophrenia and was astounded by the depth of my ignorance. I thought schizophrenia meant a split personality, that it was psychological, not medical, and people with it were just plain nuts. It's a real physical disorder, but because it affects the brain, people who suffer from it sometimes don't even know they are ill and therefore can't regulate their thoughts or behavior. They become victims of their hallucinations and delusions and often can't think straight. The next time the hospital released Lynn, we got her into a day treatment program that was supposed to offer the structure people with schizophrenia often find comforting and help her reintegrate and regain skills she had lost. But a few weeks later, the program director called and said he didn't want Lynn in the program anymore because she wouldn't attend group therapy. We asked Lynn why, and she told us that in group therapy, everyone talked about suicide and she found it depressing and against her Catholic religion, which proscribes suicide. In other words, she had two very good reasons for not attending group therapy, and because of that, they were going to end her treatment. That was the moment when I realized how dysfunctional and disconnected the mental health system had become from the needs of the seriously mentally ill. I started raising money for the New York City chapter of the National Alliance on Mental Illness, NAMI or NAMI, and eventually joined the board. The NAMI chapter was staffed by exceedingly dedicated volunteers, primarily aging mothers of persons with serious mental illness. These heroic moms answered helpline calls from other moms and gave out fact sheets. The most frequent calls were what one would expect. How do I find the right doctor? How do I find the right medicine? Is there a housing program for my relative? How do I plan my estate? But one common call was, my seriously mentally ill son/daughter/mother/father/sister/brother is locked in his room. He knows the FBI planted a transmitter in his head and won't come out. He won't eat because he knows the food is poisoned, won't shower because he doesn't want to wash away his protective field, and can't sleep for fear of attack. What can I do? There was no answer to this question, no fact sheet we could write. The law prevents parents from helping psychotic or delusional loved ones who refuse treatment until after they become a danger. As ludicrous as it sounds, rather than preventing violence, the law requires it. That realization led me on a 30-year journey to try to find out what is wrong with the mental health system and what can be done to fix it. This book is the product of that search. Introduction. Overview of everything. It's hard to determine which is more delusional, the mental health system or the people it's intended to treat. Dr. E. Fuller Torrey. America's mental health system is insane, expensive, and ineffective. Under the guise of protecting civil rights, it is killing people. Under the guise of increasing freedom, it is increasing incarceration. Under the guise of facilitating recovery, it ensures that fewer recover. In the name of protecting privacy, it causes suicide. America treats the least seriously ill, the worried well, and forces the most seriously ill to fend for themselves. The ability to get help has become inversely related to need. We move sick people from hospitals to jails and label it progress. Government funds those who created the problems rather than those with solutions. The more dysfunctional the system becomes, the more money we throw at it. Our mental health system is not based on science and has nothing to do with compassion. As a result, there are 10 times more people with mental illness incarcerated as hospitalized. Being mentally ill has essentially become a crime. Our system forces people with serious mental illness to suffer. Your happy, smart, popular child enters his late teens or early 20s, and then slowly schizophrenia strikes. First, he becomes withdrawn, scared, and non-communicative. Then he becomes imprisoned in a straitjacket of paranoid psychotic thinking that spews forth whenever he talks. My own sister-in-law told me in a single sentence, "The FBI planted a transmitter in my head. God is the Messiah. Did you see Jeopardy? Maybe I'm too smart. They're after me, trying to kill me. Why is everyone around here so crazy? I like the Beatles. Johnny is gay. Kathy, you know what she did? I'm going to be an astronaut. That way the beams won't get me. Ha 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 ha." You attempt to use reason to convince your child that something is wrong and to get help, but he's too sick to know he's sick. He refuses to go to a doctor because "I'm not crazy, and I know you're beaming thoughts into my head." You find a social worker who tries to win your son over. He refuses her help too, and because he is over the age of 18, or as young as 12 in California, Illinois, and West Virginia, he has the right to refuse all treatment. Federally funded lawyers will defend his right to be psychotic. You call the mental health department so your son starts threatening you. "You want to get rid of me. I'm going to kill you. I'm not crazy. You're crazy. Get out of my room. Stop poisoning my food." Out of options, you call the police. But they can't help either because he's not dangerous enough yet. Even if you manage to get your son into a hospital, privacy laws will prevent you from learning what's wrong or what's next. He will be discharged to your care without your knowing what the diagnosis is, what medications he should be taking, when the next doctor appointment is, or what to do. Will your son stay on the medications? Will he go off them and become violent to himself, toward you, or maybe toward a bystander? Will that make him a headline? Will you become the headline when the public blames you for being the mom of the next Psychotic killer goes on rampage. There are 43 million Americans over 18 affected with any mental illness, and 10 million with serious mental illness. At least 140,000 of these seriously mentally ill are homeless and often can be seen foraging in dumpsters, engaged in pitched battles with demons only they can see. Some 392,037 are in jails and prisons. An additional 755,360 are on probation or parole, and many of them will return to jail or prison multiple times. At least 95,000 who need hospitalization can't get a bed because of the deadly shortage. More than 5,000 kill themselves every year. Their untreated mental illnesses make them more likely to be murdered and more likely to be victims of violent crime than the mentally healthy. They die up to 25 years earlier than others. While most people with mental illness do not become violent, those with untreated serious mental illness are more likely than others to become violent. Their victims are most likely to be members of their own family. The public becomes aware of the issue only when strangers are killed en masse. Aaron Alexis had untreated mental illness when he shot and killed 12 people in September 2013, thereby becoming the D.C. Navy Yard shooter. Juan L. Go shot and killed 7 and injured 3 at Oikos University in California in April 2012. He had schizophrenia. Sung Hui Cho had untreated mental illness when he killed 32 and wounded 17 in April 2007 at Virginia Tech. Maintaining our failed mental health system is expensive. In 2014, the federal government spent $147 billion in taxpayer funds on mental health, and that doesn't include state spending. The New York State Office of Mental Health alone spends $3.5 billion annually. Since 2005, California has been investing in excess of $1 billion in public funds annually on mental health and has little to show for it. We are spending more, yet the problems are getting worse. We have to stop ignoring the seriously ill. Mental health advocates blame the problem on lack of funding. They are wrong. The mental health advocates themselves are the problem. 100% of adults feel sad at some point and can have their mental health improved. 18% had some sort of mental illness in the past year. But only 4% had a serious mental illness like schizophrenia, bipolar disorder, or severe major depression. As discussed in Section 7, the mental health industry persuaded the government to ignore the 4% with a serious mental illness and invest the funds on improving the mental health of all others. The mental health industry cherry-picks the most compliant and least symptomatic. It labels all other patients high needs and claims it is not set up to help them. A psychiatric social worker admitted to me, "A rampant problem with not only the mental health system, but the entire healthcare system is it discriminates against potential clients it perceives as being too difficult to handle." While ignoring those with serious illnesses, the mental health industry expands the number of people entitled to services by inventing new illnesses like bullying and cyberbullying. It declares poverty, bad grades, divorce, sexual dysfunction, and unemployment to be mental illnesses and diverts mental health funding to them. It even persuaded the Substance Abuse and Mental Health Services Administration, SAMHSA or SAMHSA, which develops the nation's mental health policy, and state mental health authorities to ignore science and fund politically correct pop psychology that improves nothing but the industry's own coffers. The industry convinced the states to shutter psychiatric hospitals that serve the seriously ill and enact laws that prevent the seriously ill from being helped until after they become a danger to self or others. Until the 1940s, public funds were used to treat the insane. Then we moved to helping the mentally ill, then to the even broader mission of improving mental health, then to the broader mission of addressing behavioral health, and today we've arrived at denying that the seriously ill exist and divert the funds to wellness services for everyone. The industry is medicalizing ever larger swaths of human experience. The American Psychiatric Association fuels this trend with each new edition of the Diagnostic and Statistical Manual, DSM, which defines ever greater numbers of normal emotional reactions, such as grief over losing a parent, as mental disorders. Outreach workers pour into elementary schools looking for barely symptomatic children to engorge the mental health system. Meanwhile, everyone ignores the seriously mental ill in plain sight. No one stands outside homeless shelters or prison doors to help those who really have serious mental illnesses stay in treatment. It's become harder to get into Bellevue than Harvard. And if the most seriously ill can find a hospital to admit them, they will be discharged sicker and quicker. They wind up in jails, prisons, shelters, and nursing homes, moving from an institution that was appropriate to others that are not. The solution is to replace mission creep with mission control. We have to stop ignoring the most seriously ill. We have to spend less on mental health and more on serious mental illness. And we have to base our policies on science. Insane Consequences will show how the mental health industry wrested control of mental illness policy and spending from the government. The industry focuses on improving the mental health of everyone rather than delivering treatment to the 4% with serious mental illness. Their three main strategies when discussing schizophrenia and other forms of psychotic illness is to deny it, romanticize it, or trivialize it. This book argues that the government has to recognize certain unpleasant truths about the most seriously mental ill that the mental health industry convinced it to ignore. Not everyone recovers. Sometimes hospitals are necessary. Involuntary treatment is preferable to incarceration, and there is a group of the most seriously ill who, left untreated, become suicidal, homeless, criminal, incarcerated, and yes, sometimes violent. To solve these problems, we should focus our resources on science-based treatments for those who need help the most, rather than on those who need help the least. We should move away from a system that requires tragedy before treatment to one that offers treatment before tragedy. Pretending the seriously mentally ill don't exist is no solution. Section 1 describes the insane consequences of ignoring the most seriously ill: increased homelessness, suicide, victimization, perpetration, arrest, violence, imprisonment, and suffering. It documents the drain on the criminal justice system, the danger to the public and patients, and the cost to taxpayers. Section 2 details the difference between poor mental health and serious mental illness for those new to the subject. While the boundary between the two is debatable, the extremities are clear. It describes the science of serious mental illness because policy should be driven by that science. Section 3 introduces the major mental health organizations that fail the most seriously ill, with particular attention to the Substance Abuse and Mental Health Services Administration, SAMHSA, the Center for Mental Health Services, CMHS, and the nonprofits they fund. It also identifies the good guys who are trying to convince the government to treat the most seriously ill. Sections 4 and 5 document exactly how SAMHSA and the mental health industry prevent help from reaching the seriously mentally ill and encourage the government to waste money on programs that don't help. Section 6 identifies the major federal actions and U.S. Supreme Court decisions that fail the seriously ill. Section 7 lays out a roadmap for reform. It proposes ways to eliminate wasteful mental health spending and increase the efficacy of existing spending.
Sample complete. Ready to continue?